My name is Shiori Arai, one of the small animal surgeons at the Veterinary Clinical Sciences Department at the University of Minnesota. Today, I would like to share the findings from our pilot study investigating the effectiveness of a smoke extraction system at reducing surgical smoke during electrocautery. When we perform a surgery on a patient, we often use what is called electrocautery, which helps to coagulate the bleeding vessels so that we can visualize the lesion of interest and efficiently perform surgery. It generates heat at the tip of pen-like tool and thus produce surgical smoke. Studies have identified at least 150 chemicals in surgical smoke. Higher levels of polycystic aromatic hydrocarbons have been reported in a variety of surgeries in humans. These chemicals and byproducts have caused nose, throat, lung, and eye irritation to healthcare workers, and some have experienced headaches, nausea, and vomiting when exposed to hazardous toxins and surgical smoke. Some of these chemicals are mutagenic and carcinogenic, and actually some studies have shown transmission of papillomavirus from a patient to surgical personnel. Portable smoke extraction system is designed with high suction vacuum pump and effective air filter. The smoke evacuator cautery is connected to both capture and purify surgical smoke. Although surgical smoke is listed as an occupational health hazard in the veterinary personnel according to NIOSH statement, so far there's limited studies in the surgical smoke in the veterinary setting. So we conducted a pilot study to evaluate the efficacy of the smoke extraction system. We wanted to know first how much veterinary surgical personnel is exposed to particulate matters during surgery. And the second question we had was, can we reduce the amount of particulate matters if a smoke extraction system was used? So in our pilot study, surgical smoke was collected during canine limb amputation surgeries where we continuously use electrocautery. Dogs with body weight between 20 and 50 kilograms were enrolled in the study. During the collection of the surgical smoke, no other suction systems were used in surgery. The patients were randomly assigned to either with or without smoke extraction system. To collect surgical smoke, a sterile collection tube was placed in the surgical area at the similar distance between the tip of the cautery and a surgeon's face. The sterile tube was then connected to nanoscan scanning mobility particular size spectrometer, which measures the particles as small as 0.01 micrometer up to 10 micrometer, and then concentrations of up to 1 million particle per square centimeter in a real-time manner. The data was analyzed using Wilcoxon rank sum test. Here's the graph of number concentration with or without smoke evacuator. Each color indicates each surgical case. Based on this graph, we observed substantial reduction in number concentration when smoke extraction system was used. This is a graph showing a relationship between the particle size distribution and normalized concentration value during procedures. Note the escalation of the amount of smaller particulate matters without the use of smoke extraction system. When smoke extraction system is used, which is indicated in green, the amount of smaller particulate matter was not identified as much. So our pilot study showed that the smoke extraction system seems to help reducing the concentration of the particulate matter in surgical smoke during surgery with canine patients. In the present study, we did not investigate types of particles, so hopefully these will be answered in the next studies. Since we used only one type of smoke extraction unit, we're interested in evaluating different smoke extraction units to see if there's any difference. I'd like to thank Dr. Anderson, who is a co-investigator of this pilot study, who significantly contributed to the design and analysis of the study. Special thanks to our surgical staff at the Veterinary Medical Center who helped us perform our study in the operating theater during the busy, challenging era of COVID. Lastly, I would like to thank the Midwest Center for giving us a great opportunity to conduct our collaborative pilot study. I'm happy to entertain any questions during our live Q&A session. Thank you.